As medical professionals learn more about the virus, a number of atypical symptoms are starting to emerge in some patients.
Those less known symptoms include skin reactions. Joining us tonight is New York dermatologist Dr. Michelle Henry. Welcome, Dr. Henry.
Hi, thank you.
Nice to see you. Thank you so much for spending the time with us. Can you tell us what you're seeing as it relates to rashes and other skin conditions?
Yeah, so we've converted our practice to a totally virtual practice. I'm seeing lots of rashes. Of course, my patients have a heightened concern and heightened awareness with COVID. But thankfully, most of what I'm seeing are routine rashes. So we're washing our hands a lot. We're using sanitizer. I'm seeing dry hands. I'm seeing eczema. I'm seeing acne. I am seeing some of the characteristic rashes that we associate with COVID, but thankfully, the vast majority of those patients don't have other symptoms.
Dr. Henry, a symptom registry kept by the American Academy of Dermatology describes a condition similar to frostbite. Some are calling it COVID toes. What can you tell us about that?
So COVID toes, it's garnering a lot of attention right now. In dermatology, we call it chilblains or pernio. And what you'll see are tender purple-red lesions on the toes. You can sometimes see it on the fingers. They're uncomfortable, they can blister. In patients without COVID, this is often caused by exposure to cold. Those tiny vessels constrict and it compromises the tissue. In COVID, what we believe is happening is that this virus is causing such robust inflammation that it's also compromising the vessels. So it's really interesting because it tells us a little bit about the manner in which the disease progresses and will be an area of active research and study. Lots of the patients that we're seeing with COVID toes are actually asymptomatic. They tend to be a little bit younger, but it is telling us a lot about this virus.
So how concerned should people be, Dr. Henry, if they develop an unusual skin reaction or COVID toes, for example, like you mentioned, and they're asymptomatic?
So, we should be cautious, but not alarmed. So a lot of the rashes that we see that are associated with COVID outside of this are completely benign, and we see it in lots of healthy people. Now, if you see a new onset rash and you have potentially had a contact, or you're surrounded by people who are vulnerable populations, then it is important to be a little bit more alarmed. See your dermatologist, see your primary care doctor, because we're all charged to flatten the curve. And we do that by being aware of our status and making sure that we isolate and that we socially distance appropriately.
Now, doctor, that's a tough line to walk, though. I mean, you're talking about skin rashes. They come and go all the time. But how important is it to recognize a reaction as a possible sign of COVID versus something else totally benign?
So I think it's absolutely critical because, again, we're all charged to help flatten that curve. And we know that by being vigilant. So, again, if you see a new onset rash, if you have had a potential contact, if you notice that you're having other symptoms, it's really important that we get tested, that we talk to our primary care doctors, that we talk to our dermatologists to receive appropriate guidance, A, to take care of yourself because we find it earlier, we're going to have better outcomes, but B, to protect our communities because it's really important that even if you are asymptomatic, if you're shedding, you're affecting your community. And what we want to do is make sure that we keep everyone safe to flatten the curve.
Certainly. Telehealth is where it's at, right? So that's what people should do initially. Thank you, Dr. Henry from New York. Thank you so much for your time tonight.
Very welcome.